Do you need sinks in dental treatment rooms? This video will discuss two different decisions in order to help you conclude whether you need or want sinks in your treatment rooms. First, a bit of history. Technically, sinks in treatment rooms began as cuspidors mounted to the newly evolved Wotree style dental delivery units of the 30s and 40s. This modern apparatus revolutionized the relative discomfort of dental care. The cuspidor was there so you could spit out all the little bits of tooth and carved off mercury amalgam lying all over your mouth during and after the procedure, because high volume suction really hadn't been invented and evolved. Remember, this was an age when in many dental offices local anesthetic was an additional charge. Do you want actual chance for some comfort with that? Cuspidors were, and in some cases still are, a standard rinse solution in many practices, an entirely different subject. But they still didn't address another undoubtedly more significant need: hand washing. To understand that, I have to take you back to the 60s. By then, high-powered suction was possible so that you could get rid of that spit bowl. But remember, dentists still weren't wearing gloves. So think about that for a moment. Going from room to room, sticking bare hands in people's mouths, that's when the genius idea of hand washing in every room became popular. Additionally, products like alginate became the dominant material for impression taking, and fast set alginates were much more conveniently mixed in the rooms. But what about now? Thank God that we all wear gloves at least, but it remains clear that hand disinfection is imperative to public health. So is that the only question? Can it replace hand washing with hand disinfectants, eliminate the sinks from the treatment rooms, and save some money? I mean, the cubicle you had in dental school probably didn't have a sink. So why do I need one now? Hopefully we don't have to get into the discussion of dental schools and their cost and the low level of productivity that results in them in this video. But let me suggest that you do not base what you should do in your practice upon what you learned in dental school. We'll leave it at that. So what about those hand disinfectants as a replacement for washing with water? You certainly can successfully disinfect your hands with lotion, so that's an option. But if you want to be able to do what the CDC recommends and perform a comprehensive hand washing, the question becomes, do I do this in a treatment room or perhaps somewhere like in the hallway? You could potentially save some money if you place the sinks intermittently in the hallways, but this brings up the elephant in the room question for me. Why are we having this discussion anyway? The answer is very simple. You're trying to save some money somewhere. And I don't think this is necessarily the place to do it. It's the same reason that dental schools try to avoid sinks in every cubicle. My answer would be pretty simple with regard to hand washing. It doesn't matter which you do, just make sure you do it. However, if you do a lot of surgery, I'd undoubtedly want sinks in the rooms. But there's another consideration, and I think that it's part that's overlooked in this discussion. It's patient comfort. Over 80% of all healthcare buying decisions are made by women. They generally decide where the entire family receives care. Women commonly wear makeup and may have more stylized hairdos than men, if you haven't noticed. Certainly more stylized than mine. Thus, the biggest question about sinks isn't actually about sinks, it's about freshening up after dental appointments. Think about this for a moment. You came into the treatment room well composed. Then we make you smash your hairdo against the headrest for an hour or so. We mess up your lipstick, we get your face numb, and now you're not really sure if perhaps you still have crumbles of something floating around in your mouth because you can't feel anything. So do you think that your patient loves the idea of racing out to your patient restroom somewhere out near the front desk and hoping that it's unoccupied? Or blasting past the front desk to get to the car as quickly as possible to look in the mirror in order to look presentable? Remember, their neighbors are in the office and they don't know where they are or who they could be meeting. I suggest that if you're building a new office and intend to treat financially capable individuals who make elective healthcare buying decisions, that you make sure that you have more than enough treatment rooms so you aren't desperate to turn that room over for the next patient. Let your patient freshen up in the treatment room. After all, even your physician doesn't race you out of the exam room and make you put your clothes on in the hallway. At least I hope not. So don't race your patient out. Let them get reestablished. And here's the big benefit for you. If you do this, they'll be much more comfortable to discuss the next dental care priority. And while you're at it, why don't you actually complete the checkout and payment process right there? But that's the subject of another video. If you're designing or modifying your treatment rooms, you have a huge opportunity to improve performance far beyond simply expanding capacity. Don't forget to subscribe to our YouTube channel to learn more about the many ways to transform your practice. And thank you.